Good afternoon. And today we have a pleasure of interviewing Miss Emma Cooksey. She is, I would say, sleep apnea patient. And in addition to that, she's a host of the podcast called Sleep Apnea Stories. That kind of a combination, very unique for our channel. And we're very honored to interview you. Good afternoon, Emma.
Yeah, thank you so much for having me. I really appreciate it.
And thank you very much to our audience. And if you have trouble sleeping or sleep next to the snoring partner, we would be very happy if you can share the information about our channel. Also, if you're a medical professional who trying to find the root cause of that dangerous disease and connect the dots and find the best treatment for your patients, please use our channel as a networking ground. This way we can find eventually the right strategy to cure this disease. So let me tell you my personal story, how I got connected with Emma. Actually, it happened on Instagram. I saw what Emma doing, and I think it's very, I would say, fashionable for modern world. What I offer to my patients to become an advocate for their own story, to look, to research, to get the knowledge, to get education about the disease and about the treatment available. And that's exactly Emma's story, for doing that and creating community of people who suffer from that disease. My, big respect. Bravo, Emma.
Thank
But
you.
now, on our interview, through the conversation, we'll find out how you come to that idea and what was your personal story. Please tell us, how did you find out what you actually suffer from sleep apnea? Was it easy or was it hard?
It was very difficult. Thank you for asking. That's a great question. So I probably had symptoms of sleep apnea for about 10 years before I got my diagnosis. I went to a lot of different doctors with pretty much all the different symptoms of sleep apnea. So I had really bad daytime sleepiness. I had a really tough time just making it through the day without napping. I had morning headaches. I would wake up a lot at night and I would wake up gasping. I snored. I just generally felt terrible. I had anxiety and depression, and nobody could really get to the root of that. And so I went to a lot of doctors who told me that I was just stressed or depressed and didn't look into my sleep at all. Well, then I was 30 years old and I had a new baby. And my doctor had said I was really tired because I had a new baby. And then I fell asleep at the wheel with my baby in the car. And that was really like the wake up call I needed to get the diagnosis. So I called back the doctor's office and I said I was really shaken up because I really narrowly avoided a big collision. And so I said to them, I think there's something wrong with my sleep and this happened. And so that was what we needed to get a polysomnogram. And then I got my diagnosis. So that was coming up on 16 years ago.
That's I would say, I always say on my channel and to my patients and to my community, but every patient is unique and not one size fits all. I've been doing actually treatment for people who have a sleep apnea for the last 15 years, so very similar. But even though we're all unique, but your story I hear over and over several times every day. And what's scary about that story, what males, they snore, they have a very classical symptoms, kind of in a book. But for females, we manifest totally different game. Yes, snoring, you mentioned snoring and you mentioned gasping for air. Those are classical. But most of the time, females don't snore.
They're only classical because we started with men. If we started looking at sleep apnea in women, maybe our classical symptoms would look really different, right?
That's true. That's a great observation. Yeah. So, but your symptoms are very classical for female: being tired, being depressed, being anxious. Usually, couple more things: having trouble breathing through the nose, sinuses, sinus infection, acid reflux, heartburn. So yeah, that's very good what you got diagnosed. But now, I know I listened to your podcast, and I would like to ask you, you've been a CPAP user for many years. Yes, I'm a dentist who promote oral appliance therapy, but not only. I believe in the therapy would help patients. And I actually would like to know your journey with the CPAP and successful tip how to make this therapy convenient, I would say, or comfortable, what you can go through life and have a wonderful night and very energetic day. So please tell us your story with the
So
CPAP.
I was diagnosed 16 years ago, and I have used the CPAP every night ever since. It wasn't an easy therapy to get used to. I think there's a lot of support missing for people. So some of the tips that I think that I did that are really helpful for other people starting out with CPAP. It took me a while to find the right mask, and I think a lot of times people are sent home with a mask and it's not necessarily the right shape for their face or the right size. And there are so many CPAP masks available now on the market that you really need to try a lot of different manufacturers, sizes, shapes of mask to find something that's comfortable. And so a lot of online retailers will give you like a 30-day free exchange policy so that you can just keep trying masks till you find the right one. So that's the biggest thing, I think. And then another thing that people often overlook is positional therapy. So a lot of people with sleep apnea will lie flat on their back with their mouth open, which is not ideal. So certainly positional therapy where you elevate the head of your bed and you sleep on your side, sometimes it helps people enormously because they find some people get diagnosed with positional sleep apnea where they're only having sleep apnea on their back, and lying on their side helps so much that they don't have sleep apnea anymore. But for most people, it might help a little bit, but it's free, right? So I just always suggest that people try that. And then the other thing is cleaning and maintenance of CPAP machines is so important. So oftentimes when I post on my Instagram account about replacing filters, there's a filter that has to be replaced at least once a month. And cleaning has to happen like with a mask every day, and with the rest of the machine, like, every, once a week or 2 times a week. And if people don't get into that routine, it actually affects how well their therapy functions. So that's a really important thing for people to know. But also just to know that you're not alone, and it's a lot of people do struggle, especially in the beginning.
I think it's so wonderful what you create the community for that. But before we're gonna deep dive into the community questions, I would like to ask you, you've been a really great researcher. So please tell us what type of therapy you try to find, the success with the treatment besides the CPAP machine. And again, bravo for 16 years of using the CPAP. That's great.
Well, thanks. Yeah, a lot of the different, one of the reasons I started my podcast was that there are so many treatment options for sleep apnea out there that patients aren't getting to know about. So one of my priorities with starting the podcast was to interview a lot of people who have used different therapies, all sorts of different experts, whether they're dentists or doctors or, all sorts of people. So one of the things I came across quite early was people talking about myofunctional therapy and palate expansion and breath work and how that can impact how you breathe at night. So none of those things solved my sleep apnea, but I think it really helped me to understand the importance of nasal breathing. And the importance of proper functional breathing during the day certainly reduced my anxiety levels and helped me, cope better. And then as far as like the other things, I definitely had a mandibular advancement device as part of my palate expansion.
Mm-hmm.
And that didn't ultimately help me, but the palate or the mandibular advancement device part, I think, did help. So I'm in the process of getting an oral appliance to try and help in combination with my CPAP.
That's nice because you personally experience, and I'm gonna ask you a little bit a deeper question about myofunctional therapy, because my theory or my philosophy at this moment, when I do oral appliance therapy for my patients, we offer them to do myofunctional therapy once they get their sleep apnea reduce and sleep better, when they feel energy, what they can do something on more permanent level. I'm a really high proponent of myofunctional therapy, and I'm going to be repetitive, and I want to ask you specifically how myofunctional therapy help you, even though it did not address sleep apnea completely.
Yeah, I mean, it helped me just to be aware of a lot of the dysfunction that I had going on in the way that I was breathing and eating. And just in that intake with the myofunctional therapist, we talked all about how my tongue was very low in my mouth and didn't sit at the roof of my mouth where it was supposed to be. And that really explained a lot of my high vaulted palate and the narrowness of my jaws. And so I think it was helpful for that. But yeah, the main thing I think that I realized through the whole experience was how much we need to start earlier with myofunctional therapy, right? Like, we really just talked all about how I'd developed different ways to compensate for having a really low tongue posture, when really it would have been ideal to address these things when I was, a toddler, like much younger. So I think that that's one of the things whenever I've done episodes on myofunctional therapy, we've talked a lot about intervening with children. And indeed, I've talked to people where the parent has started doing myofunctional therapy because they have sleep apnea, and then they've noticed in their young child that they have some of those signs and symptoms, and they're able to take much quicker action, which is really great. That's kind of where we need to be.
Again, thank you very much for your podcast, Sleep Apnea Stories, and because you changing the view for future generations. And I think that's a very special way. I would like to ask you a futuristic question in that sense. If you have a magic wand, I always said that to my patient, I have a magic wand, how you want me to change your sleep? So if you had a magic wand, how would you change the landscape of sleep apnea treatment therapy landscape? How would you change it? What, from your view, you interview a lot of people, you interview a lot of people who suffer from that, you interview a lot of people who trying to provide the best care. So what's your vision on that?
I think we need a lot more collaboration. So at the moment, it's very fragmented for patients. So we have sleep specialists who mainly are offering CPAP. We have specialist dentists who are mainly offering oral appliance therapy. And then not to mention, surgeons who are doing ENT surgeries, surgeons doing double jaw surgery, bariatric surgery. There's a lot of different options like Excite OSA, or like new inventions where some dentists have heard of those and some haven't. So as a patient, it's really difficult to navigate that, right? So I feel as though the way I'd like to see things change is just everybody working together for the good of the patient, and less focusing on not to be cynical, but like who makes money from what.
No, this is such a word of wisdom. I really thank you very much, Emma, of verbalizing my idea, because that's what I'm trying to do on my channel, to connect the dots, to connect. We're not headless horsemen. We have a body, and we're not treating one area.
Right.
You treat the nose, somebody treat acid reflux, somebody treat the blood pressure, and somebody treat atrial fibrillation, and it's all different pills for all of that, and no clue how it's all interact in one human body. So that's really sad. And as a dentist who is a very good observer, I see the deterioration of my patient health, and they trying to address things, but no communication between departments. So that's what we're trying to do with our podcasts or channels or community. Now, my question to you about that part of your life. What inspired you to create your podcast it's two separate questions about podcast and community, because I know you do both parts. So what was, goals of your podcast, and how you work with the community of people who come to you for help?
So with the podcast, originally I thought about writing a blog, and the feeling of that was just being isolated and alone in my own experience. So I really felt like there must be people out there going through the same thing, but I didn't know any of them, and there certainly were no other young moms who were talking about dealing with sleep apnea or being on CPAP. So I definitely had my own yearning for a community, and just also the feeling that I wanted like a creative outlet to be able to kind of share a bit of my story, but most importantly, provide a platform for other people to tell their stories, from all different backgrounds, right? So I think the final clincher when I really decided I was going to just go for it and start a podcast was I went to my general doctor, like my primary care physician, and I was waiting for my appointment in the waiting room, and there was an article in one of those medical magazines which was talking about sleep apnea, and most of the article was about CPAP, but right at the end there was a paragraph where they said some people use oral appliances, some people use the Inspire implant, other people have surgeries. And I thought to myself, my doctor's never mentioned any of this to me. And so I had a feeling of, I just wanted to explore, and try and understand better where we're at with sleep apnea and what was out there. So when I first started, it was really providing a platform for other people, building a community largely for myself, but now that's kind of taken on its own life. And just to give myself a creative outlet where I could express myself, those are really the main things.
No, this is great. And I would like to ask you, since you have a community now, how are you taking care about your community to help your people to live better life with this diagnosis?
Yeah, so it really started with the podcast, and then also the Instagram account I have, kind of, which is because of the podcast. And so people quite often will email me after they listen to the podcast, or DM me after they've seen something I posted on Instagram. And so over time, it's been 3 years now, or almost 3 years since I started. And I just kind of got into the habit of responding to anyone that would message me every morning. Although I probably shouldn't say that out loud because I only have so much time in the day. But I think by making those one-on-one connections with people, I really found community that way. I also am on the board of directors at Project Sleep, which is a nonprofit run by patients, and a lot of what they do is about building community for people with sleep disorders. So that's definitely been a huge element too.
I think I can only say I really admire what you do, Emma. I think that's the way to the future. I think the trust, trust towards medical professionals, I wouldn't call it very strong right now. And I think people have to be the researcher, people have to be advocate for their own health. And with the people like you, with somebody they can consult to, or share their story, or find information through the stories, I think that's the best way.
I think just knowing that you're not alone in trying to navigate this is a huge element of it.
I agree with you. Thank you very much, Emma. We really appreciate. And again, I want to mention Sleep Apnea Stories. And Emma Cooksey, thank you very much.